Welcome to Module 2 of the Medical Transcription online course. In this module, we will delve into the foundations of medical terminology, equipping you with the essential knowledge and skills to navigate the complex language of healthcare. Understanding medical terminology is a crucial aspect of the medical transcription profession, as it allows you to accurately interpret and transcribe the dictations of healthcare providers. By mastering the building blocks of medical language, you will be able to decipher the meaning and context of the medical reports you encounter, ensuring the accuracy and integrity of the patient's medical record. Let's begin by exploring the structure and components of medical terminology, and then dive into specific examples to illustrate their practical application. The structure of medical terminology. Medical terminology is a specialized language that is used by healthcare professionals to describe the human body, its functions, and various medical conditions, procedures, and treatments. This language is derived primarily from Greek and Latin roots, prefixes, and suffixes, which have been adapted and incorporated into the modern medical lexicon. Understanding the structure of medical terminology is the foundation for effectively interpreting and transcribing medical documents. Let's explore the key components. Root words. Root words form the core of medical terminology, representing the basic concept or meaning of a medical term. Examples of root words include cardi, heart, hepat, liver, nerve, itis, inflammation. 2. Prefixes. Prefixes are added to the beginning of a root word to modify or specify its meaning. Examples of prefixes include hyper, excess or above normal, sub, beneath or under, anti, against or opposed to, peri, around. 3. Suffixes. Suffixes are added to the end of a root word to further specify its meaning, often indicating a condition, procedure, or status. Examples of suffixes include itis, inflammation, ectomy, surgical removal, pathy, disease or condition, logi, the study of. 4. Combining forms. Combining forms are created by adding a vowel, usually O, between two root words to form a single, more complex term. Examples of combining forms include gastro, stomach, and enteritis, inflammation of the intestines, to form gastroenteritis, inflammation of the stomach and intestines, cardi, heart, and ology, the study of, to form cardiology, the study of the heart. Anatomical and physiological terminology. Medical terminology is extensively used to describe the various structures and functions of the human body. As a medical transcriptionist, you will need to familiarize yourself with the common anatomical and physiological terms to ensure accurate documentation of the patient's condition and treatment. Let's explore some examples of anatomical and physiological terminology. 1. Anatomical terminology. Skeletal system, femur, thigh bone, patella, kneecap, phalanges, bones of the fingers and toes. Cardiovascular system, aorta, the main artery that carries oxygenated blood from the heart, ventricle, the lower chambers of the heart, capillary, the smallest blood vessels that facilitate the exchange of nutrients and waste between blood and tissues. 2. Physiological terminology. Cardiovascular function, hypertension, high blood pressure, arrhythmia, an abnormal heart rhythm, myocardial infarction, a heart attack. Respiratory function, dyspnea, shortness of breath, pneumonia, inflammation of the lungs, asthma, a chronic respiratory condition characterized by airway inflammation and constriction. Pathological terminology. In addition to anatomical and physiological terminology, medical transcriptionists must also be familiar with pathological terminology, which is used to describe various diseases, disorders, and medical conditions. Let's explore some examples of pathological terminology. 1. Infectious diseases, influenza, the flu, pneumonia, a lung infection, hepatitis, inflammation of the liver. 2. Cardiovascular diseases, myocardial infarction, a heart attack, angina, chest pain caused by reduced blood flow to the heart, atherosclerosis, the buildup of plaque in the arteries. 3. Neurological disorders, stroke, a disruption of blood flow to the brain, Alzheimer's disease, a progressive form of dementia, Parkinson's disease, a movement disorder characterized by tremors and muscle stiffness. 4. Musculoskeletal conditions, osteoarthritis, a degenerative joint disease, tendinitis, inflammation of a tendon, fracture, a broken bone. 5. Endocrine disorders, diabetes mellitus, a condition characterized by high blood sugar levels, hypothyroidism, an underactive thyroid gland, Cushing's syndrome, a hormonal disorder caused by excess cortisol. Number 6. Oncological terms. Carcinoma, a type of cancer that originates in the epithelial tissue. Metastasis, the spread of cancer cells to other parts of the body. Chemotherapy, the use of drugs to treat cancer. Medical abbreviations and symbols. In addition to understanding medical terminology, medical transcriptionists must also be proficient in recognizing and interpreting the various abbreviations and symbols commonly used in the healthcare industry. Here are some examples of common medical abbreviations and their meanings. 1. Anatomical abbreviations. LUQ, left upper quadrant, twice a day. Q4H, every 4 hours. 2. Diagnostic abbreviations. CT, computed tomography. MRI, magnetic resonance imaging. CBC, complete blood count. 3. Medication abbreviations. PO, by mouth, Latin puros, IV, intravenous, SQ, subcutaneous. 4. Measurement abbreviations. mg, milligram, milliliter, microgram. Vital condition abbreviations. HTN, hypertension. DM, diabetes mellitus. CHF, congestive heart failure.